Hi, and welcome to CJC Online Church. We are very happy to have you this evening as we go into another enriching and fulfilling program looking at the different aspects of health. This is Your Health and You. Your Health and You is a production of the Central Conference of Seventh-day Adventists Health Ministries Department, designed to present health related topics by sharing evidence based information and naturopathic remedies. Your Health and You is aired every Thursday at 7:15 p.m. with a focus on general health on first Thursday, men's health on second Thursdays, women's health, which is today, third Thursdays, children's health fourth Thursday, mental health on fifth Thursday. Now, I know you're used to having an all female cast for women's health. And of course, we hope and we're praying for our hosts that you take over shortly. But we are here and we're going to go. This program is for educational and informational purposes only and does not constitute providing medical advice or professional services. Before embarking on any health related information presented in this series, kindly seek advice or counsel from a doctor or healthcare professional. So, today's Women's Health. So, today's program, we will be speaking about vaginal discharge. Yes, vaginal discharge. A very uncomfortable topic sometimes to discuss, but of course, this is Your Health and You, and of course, every single topic we have to discuss it so we can have a perspective on the medical side, the allopathic medicine, and of course, the naturopathic medicine. So, before we dive into our topic, let's enjoy a reading from the book Counsels on Health by Ellen G. White.
The Christian Physician as a Missionary.
Those who have Christ abiding in the heart will have a love for the souls for whom he died. Those who have true love for him will have an earnest desire to make his love comprehended by others. I feel sad to see so few that have any real burden for their fellow men who are in darkness. Let not any truly converted soul settle down as a careless idler in the Master's vineyard. All power is given to Christ, in heaven and in earth, and he will impart strength to his followers for the great work of drawing men to himself. He is constantly urging his human instrumentalities on their heaven-appointed ways in all the world, promising to be always with them. Heavenly intelligences, 10,000 times 10,000 and thousands of thousands, see Revelation 5:11, are sent as messengers to the world to unite with human agencies for the salvation of souls. Why does not our faith in the great truths that we bear kindle a burning ardor upon the altar of our hearts? Why, I ask, in view of the greatness of these truths, are not all who profess to believe them inspired with missionary zeal, a zeal that must come to all who are laborers together with God? Who will say, "Send me"?
us pray. Our Heavenly Father, Lord, we are grateful to you. You have called us to be missionaries. You have called us to proclaim your truth and your word to a dying world. We ask that you will be with us in a marked way. We ask that your Holy Spirit will indeed lead, guide, and direct. We pray that we will answer the call. When you ask who we go, we will say, Lord, send me. We ask that you continue to pour out your blessing upon us, that you will help us as we go through and to accomplish your will. Be with our evening's program, and we pray that you may continue to bless and keep and guide, we pray. In Jesus' name, amen and amen.
Celebrations, temperance. When you hear the word temperance, the first thing you think of might be balance, or the ability to find a balance in life. But balance is a relative concept because everyone has different needs and priorities. In many cultures and communities, the word temperance has been forgotten altogether, a term from the past. Does it still apply to your life today? Look at temperance from a health perspective and you'll see it as something crucial. True temperance teaches us to dispense entirely with everything hurtful and to use judiciously that which is helpful. So you can see how temperance isn't a checklist of behaviors we should or shouldn't have. It's a way of life, understanding that in excess, even good things could be harmful. Taking stock of your own life, you might find there are areas lacking balance, sleeping too little, working too hard, eating too much, or not exercising enough, or even overdoing it. If you ever feel incapable of finding a balance, just remember help is never far away. God is always close to you. He will make sure you achieve and sustain a successful balance in life.
Welcome back. Welcome back. I am busy looking here in the chat. Maxine, I'm not sure how different I look, but hey, I guess things need to be changed. So welcome, Sister Anderson. Of course, welcome to the very first person in the chat, Sister Silvera. We're very, very happy to have you. Welcome, Thea. Of course, welcome, King, Denise King. We're very happy to have you. Welcome, welcome, welcome. Of course, we'd like to also welcome Brother Edgar also in the chat. Remember to just drop your questions in the chat. Remember to share this program.
We do apologize for that inconvenience as we await Dr. Kemar Douglas's return. Let's take a quick look at Did You Know? Did you know that in order to keep a female's private area clean and healthy, she must 1. Avoid using perfumed soaps, gels, wipes, or other feminine products? Did you know? Don't douche or wash inside your vagina? Avoid wearing tight underwear, leotards, bathing suits, or sweaty clothes for long periods of time. Did you know? Also, did you know? Wipe your vagina from front to back, as this prevents bacteria from your rectum getting into your vagina. Did you know? Now, permit us to bring back Dr. Douglas as he will introduce our special guest for this evening.
And welcome back. I do apologize. All right, so our guest for this evening is, and thank you, Mr. Savannah, our technical producer, for jumping right in when my computer went down. All right, so our guest is Dr. Lasagna Fletcher Thompson. She's a dynamic speaker. She's an honors graduate of Northern Caribbean University. She's also a graduate of the University of West Indies. She did a residency in obstetrics and gynecology at the Hospital of the West Indies, where she served as the chief resident. Throughout her career, she has contributed to the healthcare institutions such as Mandeville Regional Hospital. She has also contributed to the University Hospital of the West Indies. Presently, she serves as an obstetrician and gynecologist at the Black River Public General Hospital, where she continues to make an impactful stride in women's health. Beyond her professional endeavors, Dr. Fletcher Thompson finds joy in her family life, being married to Emran Thompson, and of course, cherishing her precious moments with their daughter, Ella. She currently attends the Brompton SDA Church in Black River. Of course, she's from Central here. She actually from Mount Prospect, where she was an accomplished musician. She brings to discussion her expertise and passion and commitment to advancing healthcare practices in obstetrics and gynecology. Therefore, I'm inviting our viewers to type their questions in the chat. Vaginal discharge is one of those very big topics. It happens to so many women. And of course, we want to make sure we cover all our bases tonight. So make sure that you drop your questions and your comments in the chat. We're going to take a little break now. And then when we come back, we're going to be joined by Dr. Fletcher Thompson.
In a world with constant demands, every woman deserves a time of peace, reflection, and rejuvenation. Introducing the Central Jamaica Conference Women's Ministries Retreat, Repositioning for More, a sanctuary for the soul where women come together to be nurtured and empowered. Join us Thursday, October 3 to Sunday, October 6 at the Ibero Star Hotel, Montego Bay, St. James for a weekend of spiritual renewal, self-discovery, and faith enrichment. For more information, please visit www.centralja.org, email women@centralja.org, or call us 876-984-2044. Sister, make it your date. CJC Women's Ministries Retreat, October 3 to 6, 2024.
The Seventh-day Adventist Church Central Jamaica Conference, in association with Ebenezer and the Clear Park Family of God, Spanish Town, St. John's, and Sydenham districts of churches, invites you to the Blessed Hope Evangelistic Series with international evangelist Jeffrey Harriott. Starting August 4, every evening at 7:15 except Thursdays, and then on Sabbaths at 9:15 a.m. under the Big Tent at 58 Brunswick Avenue, Spanish Town, St. Catherine. Come for health and wellness programs, prayer tower sessions, free weddings, marital counseling, soul-stirring praise and worship, prizes, surprises, and more. It's the Blessed Hope Evangelistic Series under the Big Tent at 58 Brunswick Avenue, Spanish Town, starting Sunday, August 4.
All right, welcome, Dr. Fletcher Thompson. Welcome.
Thank you for having me.
Always a pleasure. Always a pleasure. All right, so we're going to discuss one of those topics that we tend to shy away from. We tend not to talk about. In fact, I can't even recall ever having a health program that actually addresses this concern. It's a very common occurrence for females. So let's start off with a basic question. What exactly is vaginal discharge?
Okay, so vaginal discharge is this substance that basically comes out of the vagina, and what it is a combination of fluids and cells that are continuously being shed through the vagina. That would be a basic definition of vaginal discharge.
So is it that this happens continuously, like all the time, and therefore it's just a common thing?
Yes, so it happens all the time, but then it can become abnormal, which is what women usually complain of. In fact, it's one of the most common things that women present to a gynecologist, or even just the hospital, clinics, the general practitioners, one of the most common gynecological conditions. But just to put it out there from the beginning, not all of those discharges are abnormal, because as we said, the definition is that cells are continuously being released through the vagina. A lot of women will make it through life without an issue, but up to 40% of women have an issue and they usually have to seek help. And when we talk about the abnormal causes, most of them are because of an infection. So I will just go ahead to kind of split them up. So vaginal discharges can be normal. I started them shuffled here on the screen, but hopefully you can still see it. What we call physiological, so the regular thing, every day, and I'll speak a little bit more on that. But it can also be abnormal or pathological, and under that category, it can be infected or non-infected. So since you asked about the continuous, I'll just go right ahead with the physiological vaginal discharge. This is what we'll see every day if you're healthy. It can be clear or it can be a bit milky white. And what we're talking about in terms of volume is nothing more than about 4 mils for 24 hours. So most persons will be able to get through the day without putting on a panty liner or a pad. It's just a small amount of fluid. It is not offensive at all. So usually there is no smell. And as I mentioned before, what it is that they're sloughing up the cells. There are some amount of bacteria in the vagina as well, but also the cells are releasing fluid, which we call transudate. This discharge is important because it keeps the vagina healthy, it keeps the vagina clean.
All right. So you mentioned that this is a normal process and that there's bacteria present in there,
Yes.
but there are some people of the opinion that no bacteria should be in there at all, and that they should actually be squeaky clean. Um, so they will want to, douche and remove them. What would you say to somebody like that?
Okay, so there are bacteria, or because bacteria is plural, that is present in the vagina. And the most common one, the one we're most familiar with, is the one called lactobacillus. Now, this one is very important because it creates or releases lactic acid. It also releases hydrogen peroxide, for example. And what it does is protects against the infection by bad bacteria. So once they are present, usually you can have your normal discharge. So not only bacteria do they help to prevent, but that's the bad bacteria, but also things like yeast infection. So once they are present, they can reduce the likelihood of you getting a yeast infection. Keeps the vagina acidic. Now, when you douche and wash out and all of those things, what you do is get rid of this good bacteria, which once it goes down, then all the other bad ones that would have been there in very small amounts and the yeast have the opportunity to just rise up. And at that point, you'll find that you might have recurrent abnormal discharges from douching.
All right. So you need these good bacteria and therefore allow them to flourish and grow. And once they're there, then the discharge will be normal. It will not have an odor. It will not itch. But some females will say, but hold on there. As I go through my cycle, my discharge changes. Sometimes get a little bit thicker. Sometimes it may get a little bit brown through my regular cycle. What's going on? What should I be concerned when it changes from the watery consistency to something a little bit thicker as they go through their cycle?
Okay, so that's a really good question. The discharge that we're talking about is very much responsive to our hormones. So, as you know, we've been talking for many months about hormones, estrogen and progesterone, but mainly estrogen. Estrogen acts on the cells and cause them to create different types of discharges. And so you'll find that at some part of the cycle, you'll have a more watery, thinner type of discharge. And at another point, it may look more like an egg white. That is fine. Now, when you should be concerned is when it has an odor. So that's one. When the color is not clear or white, when it's itchy, or if the consistency has changed, different from the milky or the thin or the slightly thick to clumpy, for example. Some persons will even report a discharge that's green or yellow. Sometimes you actually see blood. Now, that is a time that you should be very concerned and you should really have that discharge evaluated.
All right. So you mentioned a lot of colors, green and brown and red. And so what do all these colors mean?
All right. So it brings us now into our abnormal vaginal discharges. And I just had a little flow chart to kind of give us an idea as we talk about them. Now, once you change the color from white or the consistency from, just barely milky, you are going to be seeing different types of abnormal discharges based on the cause. Now, it can be either non-infective, we're talking about things like foreign bodies, we're talking about allergic reactions to even like soap. And it could also be infective, where it's caused by an organism. And on the infective, it can either be sexually transmitted or not sexually transmitted. So it's quite a number of discharge types. And I'll just go a little further. So we said that once there's a change from the normal discharge that you have, then you should be concerned. So the smell, quantity, the color, and the texture, then that can be because there's a change in the vagina's balance. All right. So just really quickly, the one that is most common, I could go ahead with that one. And this one is bacterial vaginosis. Now, you remember that bacteria we were talking about earlier, lactobacillus? If you notice on the screen, that's it in the blue at the top. Once the numbers start to fall, then the bad ones, one of them is Gardnerella, and another one comes under what we call anaerobes, they begin to increase. And as they increase, then they begin to cause symptoms. And so this one is bacterial vaginosis. Now, you might wonder or might ask, why did the lactobacillus get less? Now, if you wash it out, yes, that's one. But antibiotics, if you take antibiotics that we have in our arsenal today, they don't always know which bacteria to attack. And so they might do a you might wonder or might ask, why did the lactobacillus get less? Now, if you wash it out, yes, that's one. But antibiotics look like it's very frothy. It tends to have a fishy odor, and you might even have itching with it. Not everybody has itching with it, but women usually know that this is just not your normal type of discharge. I had mentioned this one under non sexually transmitted, but it can be as a result of, it can be transmitted sexually in that when you change partners, for example, it can also upset the bacteria that is in the vagina and cause a bacterial vaginosis. A lot of times when the person moves from barrier methods, they can struggle with bacterial vaginosis. That is one type of the discharge. So we got white frothy with a fishy odor. Let's just talk about some of the others. Another one is candidiasis, which is yeast. It is a fungal infection, very common a lot of places in the body, and it's not abnormal for it to be there. However, as the levels increase and they get out of hand, then you start to have symptoms. So you will have the complaint of clumpy discharge. So it's white and it literally looks like cottage cheese, which is right here, very, very clumpy. And the thing that bothers most persons is the itching. It can be severely itchy. And this is again caused by overgrowth of the fungus, usually because the other good bacteria has, been either wiped out or decreased. So we're two. So we had spoken about frothy white, smelly, kind of fishy, and then we have the cottage cheese one, clumpy and white and itchy. Usually doesn't have a smell. Now, sometimes you can have both mixed, and so you have some clumpiness and some of it is runny, some of it is frothy, and we call that a mixed vaginitis.
All right, so let's look at something very clear because there's a old, I think it's a soca song that's song about sawfish, and you know how we play on words back then. So you're saying that a female should not smell like sawfish. They should not smell fishy at all. It should. And once that happens, we're thinking of bacterial vaginosis.
Correct.
And if we see anything,
there's one other that could also give a fishy smell, trichomonas, but once the smell is there, it's not normal. It is some imbalance of the normal, what we call flora in the vagina. And some persons will report that they don't actually see a discharge, they just have this fishy odor. Doesn't mean that a discharge isn't present, because many times when you examine these patients, you'll find some discharge higher up in the vagina. So an odor usually is not that, it doesn't indicate that everything is okay.
All right. So is there something linked? I think some females will say, but I normally take very good care of myself. I have not taken antibiotics. I have not dosed or anything like that. But I do go to the gym. I do work out a lot. Could that be the source of their yeast infection?
Okay, so yeast or even bacterial vaginosis, yes, anything that is going to disrupt the normal flora, as I mentioned before. So sometimes even things like extra heat. You mentioned going to the gym. Some persons in sweating, in just producing more discharge during their exercise, you can throw off the balance and you can end up with an abnormal discharge, which may or may not be infected. It might just be, an excess of your normal discharge, or you might allow the growth of what causes bacterial vaginosis as well as the yeast, the fungus yeast.
Okay. All right. So you mentioned other reasons why infections can happen. So you mentioned trichomoniasis. Anything else?
All right, so for trichomoniasis, that is going to come under sexually transmitted. And so trich, chlamydia, and gonorrhea are the three most common causes of abnormal vaginal discharges that are sexually transmitted. But just to note that chlamydia and gonorrhea may not show such a large amount of discharge that it's actually visible on the outside. Sometimes there is no discharge at all. And so it's important for us to be in tune with our body. So even the slight amount, the smallest amount of discharge, you can get some amount of attention. But just to tell you a little bit more. So for Trichomonas vaginalis, it is quite popular, quite popular. It is caused by one of those microorganisms, and what you get is a very frothy yellow discharge. In addition to this, it actually can cause inflammation of your cervix. So it can make your cervix red, and you can actually get bleeding from the cervix. So you get spotting along with this discharge. So that's what trichomonas. When you look at chlamydia, as I mentioned, it can be very silent, but it's very important to, treat. So if you know that you have a partner that has chlamydia, or if you know that something is wrong, you've been having, in addition to the discharge, or you've been having lower abdominal pain, for example, it's important to get evaluated, because when you have an infection that has not been treated, you run the risk of what we call pelvic inflammatory disease, and the entire pelvis is just inflamed, and then you can have scarring, which can lead to chronic pelvic pain and also infertility. So it's not something to be taken lightly. Gonorrhea is the other one that is quite, well known, and many times it comes up with chlamydia. Sometimes you get both of them at the same time, and so that can be a cause of abnormal vaginal discharge. You might have itching, you might have pain, you might even have pain passing urine, low abdominal pain. It's not normal, and it's something that should be evaluated.
All right. So can we correct a myth concerning sex? Because a lot of Jamaicans think that when they're having sex, the female should feel pain, and the female is not feeling pain, then nothing now go on. Are you saying that sometimes, especially trick, which we don't discuss a lot, because we hear about gonorrhea and chlamydia, but we don't normally hear about trick. Is it that some of these females may have actually been infected, their cervix may have been inflamed, and therefore the pain that they're feeling is really because their system has been basically damaged by these organisms?
That is true. And along with that cause, there's also endometriosis, which we might have spoken of some time ago, that can cause pain during sexual intercourse. So you're right. Pain during intercourse is not normal, and you really should have that evaluated. But as you rightly said, that infection and inflammation can be the cause of the pelvic inflammatory disease, the scarring, and therefore pain.
All right. So you're going to go into treatment now. How do we treat these infections?
So as long as discharges are around, it can be difficult to treat. I probably should just mention some of the risk factors before, because really and truly, a lot of the treatments are just antibiotics, antifungal, and lifestyle changes. So I'll just go back a bit. I had a slide on that, so we can just quickly look at it right. So for yeast infections, for example, some of the things that can cause you to have it a little more frequently. So wearing of tight clothes, tight pants, tight underwear, especially in this heat. Well, I don't know if where you are is hot. Where I am is quite hot. So if you wear a lot of tight clothing, you don't get the ventilation in the vaginal area, and so you run the risk of throwing off the balance. So nylon underwear, poor eating habits. So persons who eat a lot of sugar, a lot of dairy products, that can cause you to have recurrent yeast infections. Hot climates, mentioned that already. Certain bath products, products that are very highly scented, soaps and shampoos also that are highly scented. If you have a hormone imbalance, and this can happen to persons near the menses, so a lot of them will say, "Boy, I always having a yeast infection when I'm close to my period." It's a thing. It happens. Uncontrolled DM, that is diabetes mellitus, that is definitely a cause of recurrent yeast infection. And then you have other infections elsewhere in the bowel, on the skin, excuse me, tampon usage, even stress and lack of sleep. All of those can cause you to have recurrent yeast infections. And they overlap with even bacterial vaginosis. So when we're talking about the treatments, apart from being evaluated by a doctor and getting the relevant antibiotics and antifungals, you can also work on these things. So you wear clothing that is not as tight. You try to keep the ventilation down there as best as possible. If tampon usage is causing problems, you might have to switch from tampons back to pads. Your eating habits, cut down on the amount of sugar. Just get rid of the highly scented soaps and bath products for now at best, just so you don't get a recurrence of the infection. And of course, if you have any chronic illnesses like diabetes, you get that controlled. So main treatment, antibiotics, antifungal for yeast, and lifestyle changes. Also remember that, for persons who are not practicing safe sexual practices, that can be causing you to have a lot of the infected, the sexually transmitted infection. And so for those persons, we recommend, improving on your sexual practices, keeping your one partner, using barrier methods.
All right. So you're saying that avoid the nylon and silk underwear and basically wear cotton underwear so that can breathe.
Yes. And yes, definitely. Much
All
more
right.
that way.
All right. So somebody online is asking, this is from Sharika Sterling Henry. She's saying, can pregnancy also cause yeast infection?
All right. So pregnancy is an interesting entity. So when you're pregnant, a couple of things are happening. Your hormones are at, a different level, all-time high for estrogen and progesterone. And so, first of all, you're going to have an increase in your regular vaginal discharge. Now, the other thing with pregnancy is that you have a baby inside, and that baby is part you and part your spouse, which means it's a foreign entity. And so, under normal circumstances, your body would want to get rid of this foreign entity. And so, in order to not get rid of it, it turns down the immune system. It's called immune modulation. Now, in turning down the immune system, you're also turning down your defenses for everything else. And so you'll find that you definitely have an increase in certain infections, including yeast. On top of that, you are hotter, and you have this belly growing in front of you, and sometimes it's down in the vaginal area is a lot more uncomfortable. That adds to your risk factor for having yeast infections.
All right. All right. So are there any non-infectious reasons? You mentioned tampons as one of them. Any other reasons why one may actually end up with what looks like vaginal discharge, abnormal, but it's not done by a pathogen?
All right, so definitely. So I had mentioned foreign bodies. That is most common in children and elderly persons, and I'll tell you about that in a minute. Outside of foreign bodies, you can have just an allergic reaction. So if you have used a new soap, a new shampoo, new anything down there, you can have just a hypersensitivity to that. And you end up with a discharge that looks a little bit different from what you are used to having, but there's no bacteria causing it. Can still be very distressing, but thankfully it's not because of any bacteria. So what you can do is just withdraw that new whatever you were using. stop using it, and usually it will go away. There are other things. Some persons use spermicides. I haven't heard of it in a while, but some persons may have access to a spermicide. A spermicide is one of those, they have it in foam where they spray it in the vagina before having sex to prevent getting pregnancy. Now, some persons are actually allergic to that and may have a discharge from it. And then you have persons who are sensitive to detergents and fabric softeners. So it's the underwear that you have on that you have washed in the detergent or the fabric softener that is causing you to have a discharge. And again, it's not infective, and most times you may not have itching and you might not have a smell. It might just be an overabundance of your normal vaginal discharge. In children, I mentioned that before I talk about the foreign body. Apart from foreign bodies, things like hygiene, unfortunately, just being overweight, the girls who are wearing tight swimsuits all the time, leotards, perfumes again, and if they have recently used antibiotics, you can have a vaginal discharge in the child. But just to note, if there is any abuse, so sexual abuse, that can be what causes an abnormal discharge. And so parents should be quite, attentive to their children. When they see a discharge as abnormal, you really should have that evaluated. So I'll just skip a little bit to foreign bodies now. All right. So in the child, and even adults who are playing around, but in the child, you can have them putting things up into the vagina. So small toys, candy, crayons, they will put them up in there and they don't know that, they don't remember they put it up in there. You never know. And, 2 days on the road, they have a discharge. So it's good to have them evaluated, have them examined so that if there is a foreign body, it can be removed. For adults, sometimes when you have procedures done, it shouldn't happen, but, you just don't watch out for it. If anything is left in the vagina, you will have a discharge. If you put tissue up in there, anything that is up there for any extended amount of time, you will have a discharge. You put a tampon in and you don't change it quickly enough, you're going to have an abnormal discharge.
What do you mean by quickly enough?
So for tampons, you really shouldn't be having one tampon in there all day. Talking about every 4 to 6 hours to change a tampon, or even more frequently, but not all day. Not only can it cause an abnormal discharge, but if you are actually menstruating, it can cause what is called a toxic shock syndrome, where bacteria can overgrow and you can be sick, very, very, very sick. So good hygiene when it comes to tampons are very important. I had mentioned earlier the elderly person, so and maybe some not so elderly person. Sometimes persons want to treat what they think is an abnormal discharge, and so they'll use home remedies, which is perfectly fine. But sometimes we forget about it. So, patients have come to the hospital with an abnormal discharge, and when you check it out, they had put a garlic in the vagina, or they had put some onion in the vagina and forgot about it. And it stays there, and the body reacts to it, and they have a discharge. So this would be another cause for a non-infective initially, because then sometimes the bacteria comes in and joins the party, but initially it's a non-infective cause of abnormal vaginal discharge.
All right, so hold on there. So are you saying that using onion and garlic is actually an effective home remedy as long as it doesn't stay in there for too long?
Well, so as I have no studies to back that up, I will not. I leave that to Dr. Lamley. But persons who have studied it, because there is information out there on what you can use for natural remedies. If you have the data, if you see that it comes from a good place and you want to go ahead and use it, then use it at your own risk. But nothing, no matter how good it is, should be put up in the vagina and left to stay. The vagina, that is, and left to stay unless it has been put there by a doctor. So, for example, persons who have prolapse of their uterus, body come down is the common term for it. And we might put a pessary up in the vagina and it stays there for 3 months. Something like that can stay up there. It should be clean when it goes in and should be assessed on a regular basis by a medical doctor. Other than that, we should really not put anything up there to stay.
Right. All right. I think there's another question online that I want to actually ask you, and it's actually about underwear.
Yes.
So the question comes from Arlene. Underwear should always get sunlight, and is it possible that a recurrent yeast infection or even bacterial vaginosis can be due to improper underwear hygiene, you want to call that. It's not being washed properly, not being sun properly. So the constant reinfection is coming from the underwear that they wear.
That is actually possible. So any bacteria that you or any germ that you're going to cause to go into the vagina is going to throw off what is there. So it's always good to wash underwear very well. It was always said we should sun the underwear because of the UV rays from the sun. And UV is, quite efficient at breaking down some of the bacteria. Now, if you are unable to do so, drying them with high heat is also fairly effective. So don't feel too bad if you're not able to get it hung out in the sun, but at least ensure that it's washed very well and it's dried very well. And then, of course, when you think about the material of said underwear, if it is not cotton, you are increasing your risk because some of the other materials do not allow for the ventilation that we would want. Not that you can't wear them, but just know that the risk is increased for an abnormal discharge.
All right. When should a female say to herself, this discharge? Before I ask a question, let me ask another little tricky question, and that has to do with the partner.
Okay.
So, if the female has a recurrent yeast infection or recurrent bacterial vaginosis, should the partner also be treated?
All right, so that's a wonderful question because a lot of times we treat the woman and it just keeps coming back. Now, if it is yeast infection, it could be worth treating the partner, but mostly the infectious causes. So definitely gonorrhea, chlamydia, trichomonas, and bacterial vaginosis. It is very good if the partner can also be treated because if the partner has an infection, they're going to just keep reinfecting the woman. So that's an excellent question. Once you have an abnormal vaginal discharge, it would be good if you could either present to the doctor with your partner so that both of you can be treated for the discharge. Also, if the partner doesn't have any symptoms, still it is useful for both persons to be treated.
All right, excellent. Our host is asking Jennifer Morris, can the pessary cause a discharge?
Yes, it can. And the thing is, it's a foreign body, albeit a fairly innocuous foreign body because the material it's usually made from is such that it doesn't really cause a reaction. But everybody's body is different. And so you do have persons that it doesn't matter how innocuous it is, having a pessary can cause a discharge. No, the discharge that you're going to get might be your regular discharge that is increased a little bit, which is tolerable, or it could be that some infective organism got introduced while it was being placed and you have an actual infection. And in that case, what you can expect to see is a more yellow, foul smelling discharge, which means that you need to be treated and you might more than likely will need the pessary to be removed.
All right. And let's talk about, of course, the copper T. Do we want to worry about the copper T?
So the copper T is placed in the uterus. It's higher up. It's copper. It causes an inflammatory reaction. Yeah, I mean, you can have an increase in the discharge. Now, if you are well, if there is no microorganism that has been introduced with the copper T at the time of placement, and if you have not gotten an infection, you should be okay. But you do have persons who have high-risk behaviors, who may have multiple partners, or who may have a partner who has an infection, or who may have had the copper T placed under not so sterile conditions, and they develop an infection. Yes, they can have a discharge, but they can also just have severe lower abdominal pain. And in that case, you would have to consider you have to treat it, and consider removing the copper T. But generally speaking, if it is put in under aseptic conditions, that's clean conditions, and you practice good sexual practices, and you did not have an infection at the time, a copper T should be fine.
All right. Okay, so to recap, vaginal discharge is quite normal, happens every day, and it may slightly change throughout the life of the period cycle. And so So therefore, just so that everybody can be clear, at what point in time should a female be concerned about her vaginal discharge?
All right. So if you think about what is normal, anything that is an aside from normal, it should prompt you to get some evaluation. So we said that is a small amount. So if you're used to not having to wear any underwear or any pad and you're not pregnant, and you suddenly see an increase in discharge, you might want to get that checked out. But that's not as red flag as others. Other things are if the color changes. So you're used to your clear or white, it has now become yellow, brown, green, has an odor, itches, and even if it is white but it's clumpy and itchy, then you definitely should get it evaluated. I noticed something in the chat that is really important here. Just remember that the vagina has been, wonderfully made by God, that it cleans itself, so it keeps sending out this discharge, and you should be able to get rid of things that are bad. But if you wash out the good bacteria, and you try to bathe up in there and do all sorts of things, then you run the risk of losing that mechanism, and then you have you result in an abnormal vaginal discharge.
All right. Thank you, Dr. Fletcher Thompson. At this time, we're going to take a little break. Remember to drop your questions there in the chat, and we'll see to answer your question right after the break. And of course, we hope to be joined by Dr. Joan Lanley, who will present on the naturopathic remedies.
The Central Jamaica Conference of Seventh-day Adventists invites you to the Blessed Hope Evangelistic Series concert on August 17, 2024 at 7 p.m. under the Big Tent on 58 Brunswick Avenue, Spanish Town, St. Catherine, featuring music ministers Carrie Sales, Osana Praise, Immuna, Ramden Brothers, Juanita Gooden, Nayoka Grant, Euphoria, Nakita Wallace, and so much more. That's the Blessed Hope Evangelistic Series concert. Admission free.
All right, welcome back. This is Your Health and You. We are looking at, of course, vaginal discharge. And welcome, Jennifer Morris, our host. I understand the struggle.
Be here. Yes.
All right. Dr. Lamley, we're unable to see you, but we know you're here. There you are.
I'm here.
All right, Dr. Lamley. So it's your time to tell us what are the natural remedies for yeast infection and, of course, bacterial vaginosis.
I think I want to piggyback from where Dr. Fletcher left off. This part of it, that our bodies are wonderfully, fearfully made. And God has designed this human body to take care of itself. All the things that happen in any kind of sickness or disease come upon us, the body was made to respond in a positive way to keep us healthy. And I like the word of God when he said in Psalm 104 verse 14, I have created the grass for the cattle and herbs for the service of man, so that man can go about his labor. So the body in itself always tries to make itself right. And then to assist that, God now put many things in nature to give us that assistance that we might need. So she said she would want to know about the garlic. So I'm going to mention a few of the things that I've used successfully and give you an example. Well, let me go to the garlic first, since that was the one of interest. I have used garlic with my clients successfully. What I'll do, I will take a peg of the garlic, and then I will use a sterilized needle and just put some perforation in it, some little holes in the garlic, and then I will thread through the needle with either dental floss, the unscented one, or sterilized thread. and then they would insert this in the night. And I tell you something, in the morning, when you see that garlic, you'd be amazed what the body actually takes on to itself or let go from what is happening. So it has been successfully used, Dr. Fletcher. I've done it a number of times with my clients, and they have gotten good success rates with it. All right, so let me look at some of the other things that we use. I also use boric acid. Boric acid is really good because remember how the body is set. The blood is slightly alkaline, but the vaginal area is very acidic. Very 3.5 to 4.5, somewhere there. All right. And therefore, the body need to be kept in a certain condition, or the vaginal area need to be kept in this condition so that it can take care of itself. But there are many bad habits that we have, Virgin, that tend to cause the body to be out of balance. What are some of these? We like sugar. In general, we love sweet things. And the more sweet things we put in our body, the more we are allowing ourselves to have pathogens and all kind of things invading us and keep the body out of balance. Then we like dairy, and most dairy food, they're hormone imbalance articles. All right, so but we like to have them, and they put our hormones out of sync, and then we end up with this kind of sickness. Also, we like fatty foods. This is another crime against our vaginal area, ladies. Fatty foods, because the fat has to be broken down, and they are extremely acidic to your system. It takes so much to break these down. Also, we have the meat. Meat is one of the most acidic food that you could come across. All right. And then the more we consume, especially if the body is already out of balance, then we will pay the price for it because the body is not in a position to help itself. All right. Another thing that we do, ladies, we love to bathe with bath soap. And bath soap have a substance in it that is called lye, Lye. That is what technically makes your bath soap a soap. But lye is very alkalining, while the vaginal area is very acidic. So when we use this bath soap it up and wash ourselves with it, we are literally stripping ourselves of this acidic nature that it has. All right? So we don't need to bathe with bath soap in our areas. We don't need to use bath soap down there. You can put a little vinegar in your water and wash with it. All right, because it's acidic, it can maintain the pH balance. You don't need to be using that, or you use your soft gel. That is better than using the bath soap. And the scrubbing that we are accustomed to doing, we really don't need to be scrubbing ourselves so much, right? We just need to have a constant maintenance. Another thing that we use is golden seal. Now, this is one of the most powerful herbs that God has created for man. Golden seal is nature's antibiotic, and you can use it in two ways. There is a substance in it that's called berberine, and berberine is slightly acidic and really good as an antibacterial medication. So you can take it internally. You can take it as a tea, just half of a teaspoon, all right, in about 4 ounces of water, and it can be done twice. Now, I'm not saying anyone should go out and do this because you need the consultation of someone who knows what they're doing before you just go and buy it and just start doing it. But I'm just giving a rough guideline of how we treat this. And I tell you something, as long as person keep to what was recommended, they don't have recurrence. All right, as long as they keep to it. You can also, I know most times persons say you don't use douches, but this would have been different from you just doing it. This is a therapeutic usage that you will have. You could use a golden seal, half teaspoon in warm water, and you can use the same sterilized water, and you can use the same application. It will make the area very much more acidic, the berberine that is in there, and that is excellent for maintaining pH balance. If you notice, the pH balance of your blood is different from that area, and therefore you have to work at maintaining it. Many of our habits are just bad. And when we have bad habits, the body is going to rebel. The body is going to be doing things to let you know that, listen, I am not okay. You need to make changes. And as we make the changes, then you're going to find that the body starts responding. Look at your diet. Look at your diet. That is the first place to start. Another thing that I notice with persons, we tend, say some ladies wear pants or tight fitting underwear, and yet they're wearing not stocking, pantyhose, this nylon thing, and you're squeezing up this area that is producing more and more heat. If one thing you can be sure of is that germs love moisture. Okay? So the more you keep that area moist, is the more you're making yourself available or predisposed to have these conditions. All right? So wear breathable material. Don't tight up yourself. I know sometimes you want to look a certain kind of way, but leave it for such time. But wear things that your body can literally breathe. Don't put on too much clothes. And I'm not saying ladies go without no, but I'm saying wear breathable material, fitting, but not tightly fitting, so that the body can have its chance of breathing carefully. All right? So maintain a healthy lifestyle. Your body will start telling you when it is going out of work. That these conditions they're not death sentence, they are just about it telling you that if you don't change what you're doing, if you continue to eat the way you're doing, if you continue to bathe the same way, if you continue to wear the kind of clothes that you're wearing, then you're always going to have some form of infection going on in this area, because it's a very sensitive area. And the body wants to clean itself. The body wants to ensure that it is kept pristine like God intended. It cleans itself, doesn't it? But we can block the ability of the body to clean itself because sometimes we overload this system. And when we do that, the only way that it can be done correctly, even if you take medication, if you don't make the lifestyle changes, it's going to come back. I remember one lady, she had it 5 times before she came to see me, and I had to go through step by step, telling her what she need to be doing. And then that is about like 4 years, and she never had an occurrence. Why? Because the lifestyle changes have to be made. I think that's what I have to say.
You didn't talk about the onion.
I tell you, there's a robust discussion going on, Doctor, in the chat about the onion and the garlic, and some people are saying burns and all kind of things. So I think, Dr. Lamley, you need to tell him about the experience some of your with these things.
All right, I never
onion, garlic, really.
I've never used the onion. I've never recommended onion. I've always worked with the garlic. All right. And it doesn't burn. It does not burn, because only way it will burn you if it is cut and the outer part is exposed. But once you just use that needle, just to perforate it, just stick the needle in so that little holes are there, it won't burn you that way. Just ensure that you don't cut off any part of it. All right. And I normally give it for overnight. They take it out in the morning sometime. When you look at that, the curds, the green colors, some things that you'll see. But guess what? They work effectively. I cannot talk about the onion because I've never tried it. I also recommend that they use activated charcoal on the underwear. Now, activated charcoal as a way of pulling things onto itself. So once it is on you put on like a shield, and just put some charcoal on it. All right. If you're afraid that it might, mess you up some, you can mix it with a little olive oil or coconut oil or something, and you just put it on that shield, and you can wear that, and it will start drying. At the end of the day, you'll be amazed to see what it looks like, the things that come out from the body. You're wonderfully made. God has put things there that you can be made whole. And as you start using them, you're going to find that the body starts responding nicely to it.
So just to be sure, you say we don't strip away what is on the outside of the garlic. We leave that on. You just make little holes.
No. You strip the garlic, but what I'm saying, be careful that you don't cut it.
Oh,
so you're going to be taking off the outer, what do you call it, shell or something? You're going to take off all of that part, and only the naked garlic would be there. But you don't want to cut it. So what I do now, the bottom part, where that harder part would be, that is where I use now. I advise person to string the floss or the thread through that area, and that would form the bottom part, just like you'd have used a tampon. All right. And I tell you, within some person, depend on what is going on with them, within 3 to 5 days, all that itching, all of these things, all that smell, it is just gone. And I let them use the charcoal along with it during that time. And of course, the change of diet. I cannot overemphasize that. You can't continue doing the same thing and expect different result. All right.
Dr. Thompson, I saw something in the chat that I thought was important to bring to your attention. And it says it was by Sister Brian that says, with children or even adults, can wiping from back to front cause abdominal discharge? And I'm thinking sometimes how women wipe, they're not aware of how they should wipe. What are your thoughts on that?
Dr. Fletcher, you're muted.
Yes, we're not hearing.
Sorry about that. Right. So when you are wiping, the idea of wiping from front to back is so that the microorganisms that are found in the anus, rectum, in the gut, which are normal in the gut, you don't introduce them going from back to front. Any time a microorganism goes where it should not be, no matter how it was good elsewhere, it can cause a problem. And yes, you can get an abnormal discharge if you pass enough of that bacteria into the vagina. So proper hygiene, wipe it from the front to the back is the way to go.
Thank you. Somebody says when you insert garlic overnight and in the morning you're experiencing blood, that means you're having a bloody discharge. What is causing that?
Well, that could be an irritation. Maybe it's an irritation of what is going on. Depends on how inflamed the vaginal area is at the time. So that could be because of irritation in the area. But if that is happening, I wouldn't advise a person do it again, because maybe it is something worse than what is happening really. What you thought is happening, if you get the diagnosis that this is what is happening, that you have vaginitis or something like that, BV, any of these, and then you want to use something natural, fine. But if you just have this discharge or this itching and you just want to use something, I don't advise that. Always get yourself checked out to find out what is happening to you before you put anything in your body or on your body. That's my advice.
Dr. Fletcher, Thompson?
Yes, I definitely agree with you, Dr. Lamley. And I'm glad that person brought it up, because there's a cause of vaginal discharge that we never mentioned at all. And this is cervical cancer. For persons who have cervical cancer, you can have this persistent, smelly discharge, especially persons who have not had a pap smear in a long time or an examination. And you can have this awful discharge. It can also be bloody. So as Dr. Lamley says, by right, you should have an evaluation of the discharge so you know what is happening so that you can properly treat it. If you hadn't gotten an evaluation and you put garlic up where there's cervical cancer, you can imagine what the results will be. First of all, it won't, and then you will not be able to get the treatment you need for, in this case, cervical cancer. So very important. Evaluation first is quite important.
Before you go, Dr. Fletcher, Thompson, when should a female get her pap smear, and how often should a female get her pap smear done?
Okay, so we have what we call tiers, high risk, low risk patients, and if you look in the literature, the recommendation at this time is every 3 years for women, starting as early as 21, going up to about 65. Now the thing is, in Jamaica, we have found that we have very high risk women. We have persons who have done their pap smear last year, and this year they're back with florid cervical cancer. And so you'll find that a lot of the doctors, a lot of the medical practitioners may recommend a yearly pap smear. But as I said, what is recommended is really at least every 3 years. And if for a high risk person, especially persons with, for example, HIV, multiple partners, you might want to do it more frequently, which is yearly. And in Jamaica, as I said, we kind of nudge you to go yearly if possible.
All right. Jennifer, anything more from the chat?
I am not seeing anything except some persons talking about steaming with onion and steaming with garlic. So I suppose.
Lovely. Explain that one.
So maybe Sister Lambi can shed some light on that. I
Yes.
know persons use warm water, and I suppose with vinegar, I've heard all kind of remedies. So
Yeah. There are some steams that we call yoni steaming. All right. And just like sometime you want to do your face, you can just go and steam your face because it is helpful and all of that. The yoni steams are really helpful in a lot of conditions. But as I said, I don't want person just go pick up something and just hear that something's good and just do it. Because if there are other things that's going on inside, Dr. Fletcher had mentioned the cervical cancer. And you go and you sit over some hot water and all of that. I'm sure it's going to irritate it. All right. I'm sure you're going to be feeling it. And I don't know what else will happen. So I would say if it is that you have already done your examination, your assessment was done, and it was determined that is just maybe BV or some other simple condition that you have, fine, there are things we can recommend for you. The steaming is very helpful, but don't just get up and do it because sometimes you can hurt yourself instead of healing yourself. There are herbs that are excellent for doing that. One of the simplest things that you can do though in any situation is to take a little vinegar, warm vinegar water to wash the area. That is actually very good for ensuring that good bacteria will populate that area. All right, and we'll keep you clean and move away from using the lye soaps. All right.
okay. Is there a specific brand of vinegar or all vinegars?
All vinegars are created equal. They are just a matter of who make them and what. So vinegar is 5% acetic acid, as any chemistry student will tell you. So it's just a matter, get the cheapest one you can. You don't have to worry about it. It does the work wonderfully.
I see Paulette saying, I don't have a discharge, but itching on the outer part. Doc?
Dr. Fletcher?
Dr. Fletcher, this here.
All right, I'll share it again. Paulette says, I don't have a discharge, but I have itching on the outer part.
All right, so itching, just like discharges, can either be caused by some infection, even though you don't have a discharge, or it can be non-infective. So you have to think about things like, reactions to soaps, detergents, fabric softeners, as well as you could actually have some infection going on there. And so again, it's good to be evaluated because here's the thing, some persons have a discharge, it's just that it never came out, it wasn't enough to be seen on the underwear, and all you have is the itching. When you're assessed and someone takes a speculum and looks up, you realize that you have a discharge. So always good to get evaluated. If there's no discharge at all, it's something that you treat like a rash then. And you can, you have different creams that can be used for it once it is not anything else that needs to be treated differently.
Okay.
And Jennifer, please remind us, the human body doesn't get up and just itch itself. It doesn't happen. Once there's that itching, it is telling you that something is wrong someplace. All right. So we can't say, well, I don't have this and this, and so I'm okay because I'm not having. No, if even your hand, if it starts itching, it is telling you that something is wrong with that hand and you need to do something about it. So something is going on wrong, and it could be something as simple as even your soap and the harsh chemicals that we tend to use on our skin sometimes, right? Yeah.
Especially those sweet ones that we like to use, right?
Avoid them, sister. Avoid them. And the wipes. We have an affinity to wipes, and some of these wipes, they are not the best things for us. All right.
All right. So I think you answered Maxine's question. I think she was saying something about what if she just wants a purification, like a facial, and you were talking about the vinegar steam or the vinegar wash just to populate normal bacteria and so on. But somebody asking here, what are the early signs of cervical cancer?
Okay, it's going to vary among persons, but what is really important is that sometimes the early signs are completely missed. So you might have nothing at all.
Nothing at all.
We have persons who show up with when you examine them, there's a proper mass on the cervix and they never really had anything. But things that you can look out for is an abnormal vaginal discharge, bloody vaginal discharge, bleeding in between your periods, foul smelling discharge, I said that already, discharge, low abdominal pain, problems passing urine, problems passing stool. And as you go up the stages of cervical cancer, the symptoms will be different. But for early, it's either nothing at all or just an abnormal discharge or abnormal bleeding.
Okay. All right. And I am seeing something about Sister Lamley saying apple cider vinegar, but she did say all vinegars are vinegars. All vinegars are equal. So I think that answers the question.
All right. So thank you very much. Thank you very much, Dr. Morris. Thank you very much, Dr. Lamley. Thank you very much, Dr. Fletcher Thompson. It has been a wonderful program. We went over our time, but it's quite fine. It was one of those discussions that we had to deal with and get it out of the way. So thank you very much for being here, being a part of our Your Health and You. This our Women's Thursdays. I always say Wednesdays. All right. So thank you very much for being here. Thanks for watching. And remember to share this with your family, with your friends. It's on your status. Continue to spread the word. Continue to share. Continue to allow the blessings of God and, of course, the natural remedies and the allopathic remedies coming together, science-based, to make sure that you are healthy. Next week, Thursday, is our focus on children health. I want to look at breastfeeding. That's for next week, Thursday. Thank you very much for watching. And remember, the beloved text for this department is 3 John 2. Beloved, I wish above all things that thou mayest prosper and be in health, even as thy soul prospereth. God bless you. And remember, take care of your body temple and indeed allow God's prosperity to fill your life. Do have a wonderful evening.
Hello, everyone. Parenting is a very serious, God-given responsibility and should never be taken for granted. It is against this background that Central Jamaica Conference, through its Family Ministries Department, will be hosting a very special parenting summit at the Mapen Seventh-day Adventist Church on the 25th of August. We'll begin at 9 a.m. and go to 1:30 p.m. Now, we want you to be there. We have invited a number of experts and agencies to deal with this subject. Whether you are a parent who is doing well, or you're struggling on the journey, or maybe you're not yet a parent, we invite you to share with us. If you need more information, you can email us at family@centraljamaica.org. Please make it a date and don't be late. Looking forward to seeing you there as we seek to become better